Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. If you missed our live show, it is only available on our YouTube channel. What a fantastic conversation we had with Director 4 David Muntz, Sue Shade, around what's next in health IT. You can view it on our website with our new menu item, appropriately named Live, or just jump over to the YouTube channel. And while you're at it, you might as well subscribe to our YouTube channel and click on Get Notifications to get access to a bunch of content only available on our YouTube channel. Live will be a new monthly feature only available on YouTube. How many times did I say YouTube in that paragraph? Subscribe to YouTube. We're going to have some great stuff over there. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. All right, today's conversation is with Josh Saul, Director of Innovation and Ambulatory Clinical Systems at Houston Methodist. You have a really long title, Josh. I'm sorry I messed that up a little bit.
Not a problem. It happens.
Well, welcome to the show. You're really in charge of innovation around the outpatient, patient engagement, interoperability, all that stuff for Houston Methodist. Is that pretty close?
Yep, that's correct.
Fantastic. So Houston Methodist, obviously the name tells us where you're at. But isn't that where like President Bush was there? Is that
yes?
That it?
Yep,
Okay,
he was treated with us. We're about an 8-hospital system. We have an integrated academic location at the Texas Medical Center. We've got about 2,393 hospital beds with about 25,000 employees. That kind of makes up Houston Methodist as a whole. Yeah.
Wow, that's big. And by the way, I didn't violate any HIPAA that was in the news.
That's right.
President Bush was at Houston Methodist. So thanks for taking a few minutes to meet with me today. I really appreciate it. So give us a little background on your organization as it progressed through the pandemic. What kind of things did you experience? What kind of things did you roll out?
Yeah, I think our leadership had some really great foresights looking at COVID and how the pandemic was progressing. And in my world, we took some really strong steps in virtual medicine. We kicked off right around the March 6th and 9th timeframe. We started training our physicians, prepping for virtual medicine. We started with about 66 MDs that were doing virtual, treating virtual urgent care or doing primary care. But quickly, within about 3 weeks, we hit about 900 MDs. This was a huge undertaking to be able to train it. And for those of you who don't know Houston Methodist, we actually developed what's called our Center for Innovation Technology Hub. That's where it is really focused in on tools, digital health tools that our end users, whether it be patients, consumers, clinicians, can come in and trial out these technologies that are going to be really breaking the mold in the future. And so what we did with that technology hub, it's about 3,500 square feet. We actually turned it into a virtual training center where our physicians could come in and get hands-on experience with using tools to support treating patients when they're in isolation. So we had a huge influx of training, and our technology hub was able to support that. As the pandemic started to really hit, our teams focused in on more and more virtual. We were doing about 1,000 virtual visits a week prior to. We now average about 15,000 a week. We just recently hit our 100,000 virtual visit mark in a span of 6 weeks. And it's just amazing to see the growth that has occurred.
Yeah, so is the hardest part of that all right, so gosh, man, I have like 15 questions. So focus, Bill. Let's see. So is the hardest part of that the training? Because it sounds like you already had the virtual workflows in place. You already had the telehealth solution platform in place. So you just scaled that up a little bit. You had to train the doctors. The workflow was already baked. Is that pretty accurate?
Yeah, that is actually. The training was the hard part, but we also experienced issues like many other telemedicine groups are seeing where you just couldn't anticipate the growth. And so we had to add licenses to be able to do concurrent connections. And we continued to add them up so that we could keep the movement of the video exchange occurring. We, like many others, were just kind of continuing to ramp up and up so that we hit and had enough of those licensing. So that was a struggle from an IT perspective. The other struggle was establishing support. So now that you have more physicians doing telemedicine, how do you support that? So we had a couple strategies. We actually developed a Telemed rapid response team. These were originally 2 individuals, then it turned into 8. We focused in on Epic tools, Haiku, Canto, making sure that they were video applicable. That way we could support that. We also had Amwell as a group that was our virtual urgent care. We had team members that were able to support that through our My Methodist app. Developing that support was really important. On the operations side, who did an amazing job of supporting their physicians and patients, they actually spun up a patient support line so that when patients had issues, they could call directly in. We instituted a thing called telerounding. I'm sure many of you other organizations have done that as well. But our telerounding, our CMIO, Dr. Nicholas Desai, had a vision to create what was called telelounges in certain conference rooms inside of the hospital so that our physicians could go into those telelounges and beam into a COVID isolated patient, which started to create our telerounding experience. We think that is going to continue to grow and expand. I don't see that stopping. It helped us to save on PPE and created a good positive experience for our patients.
Wow. I had Nicholas Desai was on the show a while back with CEO of Notable, Prani Kapadia, I think it was. Yeah, and that was an interesting solution as well. So you guys have a pretty sophisticated innovation and digital capability. You guys seem to be pretty advanced in how you're solving problems. I mean, is there a framework or methodology you have in place for innovation at your organization?
Yeah, so we certainly have strategic goals that we're working to hit, and we continue to develop a solid framework of reviewing technology, developing the strong business case with our operational partners, and then developing success metrics to say whether or not this project was successful. If it was successful, fantastic, we move forward. If it wasn't, then we would succeed fast or fail fast, and we will fail that project. And we actually highlight those because that's an opportunity for us to learn. And so by learning that, we can grow the mission of innovation going forward. The other big thing that we did was, as I mentioned before, is we developed that technology hub. That technology hub is where we are trialing breakthrough technologies like ambient listening in outpatient clinic rooms to be able to capture sound from a physician and patient, differentiate that, and then code and create the notes for the physicians and create actions around it. Notable is another one of our innovations where we saw success around essentially taking wave files and using automated intelligence robots to type up the note for physicians and create actions on it. Saved our orthopedic physicians a tremendous amount of clicks. As you guys know, EMRs are really task-oriented, click-heavy. Our goal in the Technology Hub and Center for Innovation is to reduce the amount of clicks and to create that physician-to-patient eye contact that, when you integrate an EMR and a screen right in the middle, you kind of break that. So our goal is to really break that barrier and to not have that any longer.
All right, so we're entering a different phase here. So you're in Texas, I'm in Florida. These are 2 markets that are starting to open back up. So how is digital going to help in the process of reopening the hospitals?
I think we're going to continue marching down the same paths that we are doing. We're focusing on patient experience and accurate clinical documentation and interoperability. So we, as part of our efforts with COVID, we deployed 250 Alexas into the room so our patients who were isolated could feel less isolated. They could play music, they could chime into, break into their echoes, use the echoes for their loved ones. We also deployed patient engagement iPads where our patients could play games, Netflix, Hulu, type approach where they're actually have it in the room. We see that expanding. We see the patient experience focus, continuing to expand across the organization. Now, we have started to open up for surgeries, elective surgeries, and we have started to do diagnostic imaging, and we see that volume ramping up. Our clinics have opened up, and we're starting to see patients in a measured way, very measured way. We are also continuing to leverage telemedicine, so we see that being as a constant. And so we're trying to grow all that together. Where we see digital is creating that positive patient journey, that frictionless journey. One of the Tech Hub goals is to create a contactless check-in, where we're not actually passing questionnaires back and forth or collecting money. It's all done via mobile check-in.
Yeah, it's interesting. I have my daughter who's going to Baylor. I'm not wearing the Baylor hat this morning, but she's going to Baylor, and she was asking me, do you think this will be the advent of essentially, the mobile pay and those kind of things was how she phrased the question. And this will change our behaviors in a lot of different areas. I mean, you mentioned you put Alexa in all the rooms. I assume you're not going to take those echoes out of those rooms. You probably put cameras in a lot of rooms that didn't have cameras before to facilitate the physician lounge. That's probably not going to go away. There's probably not going to be as much paper. What other behaviors are you looking at, and what other things are you looking at that potentially might change as a result of the environment we're currently in, that you have to come up with different types of solutions?
Well, we are heavily invested into a virtual ICU. So we started that deployment this year. It was about an 18-month plan to deploy, and now we've accelerated that ramp up to do our entire system with virtual ICU by the end of the year. So we see that as being a big win. So creating a foundation of virtual care is going to be a continued focus for the organization.
Yeah. So when you think about long-term impact, it's we've changed behaviors. We've changed so many behaviors over these couple of months. That really does catapult things forward. Is the challenge just integrating all these things? I mean, okay, so we have an echo, we have a camera, we have a virtual lounge, we have but at the end of the day, these things have to feel sort of architected and orchestrated, don't they, in order to create that process? And what does that work look like?
So, our goal has been to develop on a solid foundational platform. So when we're on the same platform and talking the same language as an organization, we can really start to innovate. So our goal for virtual, for example, we had a couple of virtual vendors, maybe 3 to 4. We're now consolidating down to just 2, possibly, creating that just kind of level playing field. Changes our discussion. We no longer have to think about the technology. We can think about the business strategy and support that business strategy. Same thing with moving to Epic. We were a best of breed shop before, where we had multiple integration points, and now we've gone on to Epic in about 2016, and that's when our innovation really started to flourish, because we're all speaking the same language. We're no longer worried about master patient index of multiple systems. We now have one patient, one record, and we're able to have different conversations around experience. So I think, to your point, developing that common architecture so that we can support our business leaders has been a mission of ours, and we continue to push on that. Yeah,
but Josh, thanks for taking the time. I'll bet you guys are happy that you finished that in 2016, because
we are.
if you were trying to deal with some of that now, it would be very difficult.
Definitely are. Definitely glad we went through that.
Well, thanks again for your time. I really appreciate you, all the stuff you're doing. We will have to check back later. I'd love to hear how things progress.
My pleasure. Thank you for your time.
Thank you. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email and let them know that you value and you are getting value out of the show. And also, don't forget to subscribe to our YouTube channel while you're at it. Please check back often, as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.